Welcome to Magnolia Medical Minutes, your local source for medical advice direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens with Super Talk Mississippi Media, and today's special guest is internal medicine Dr. Ben Long. Thanks for joining us today.
Thank you for having me.
I look forward to this conversation regarding end-of-life planning. So why is end-of-life planning important?
Well, every single person at some point in their lifetime must face the reality of death and dying. And as both healthcare providers and human beings, it's our responsibility to help each other do that while maintaining a firm grasp on a meaningful life. I've heard it said that we suffer more when we don't communicate our wishes, and we suffer less when we know how to honor the wishes of our loved ones. But the reality that we see every day in the hospital is less than 8% of Medicare beneficiaries have actively engaged in any type of advanced care planning.
What exactly is involved in advanced care planning?
Yeah, so advanced care planning first involves completing what's called an advance directive. And in this context, advance means beforehand, not complex. So completing an advanced care directive involves two things. First, it's a living will. And that document outlines a patient's wishes for the type of medical care that they want to receive if and when they were sick. The second part involves completing what's called a durable power of attorney for healthcare. And that involves designating a person to make healthcare decisions on a patient's behalf.
Okay, so tell me, who completes an advance directive?
Patients and families can complete an advance directive on their own or with the aid of legal counsel. Providers, on the other hand, should be engaging patients and families about a few things, and that includes prognosis, anticipated care needs, and assessing decision-making capacity. Both providers and patients ought to carry out regular reassessment of these goals and decisions to ensure alignment with patients' evolving wishes.
So tell me, how is all this put together?
So there are many resources out there that can help patients and families engage in these conversations. A few of the websites that we like to highlight would include prepareforyourcare.org, 5wishes.org, and my personal favorite, deathoverdinner.org. All of these sites provide interactive step-by-step guides that can help transform what can seem like a difficult conversation into one of deep engagement, insight, and empowerment.
Awesome. Well, Dr. Ben, thank you for joining us. I appreciate you coming in today to talk about end of life and what we need to prepare for that. Be sure to join us again on Magnolia Medical Minutes for your local expert medical advice directly from the doctors at MRHC in Corinth.